what SIHI is and what SIHI Talks is all about. We are the Social Innovation and Health Initiative, SIHI for short, pronounced as SIHI, which means upward and forward-looking. SIHI is a global network of passionate individuals and institutions who dream of a healthier and more equitable world through social innovation. Since 2014, we have been advancing social innovation in health through research, capacity building, and advocacy. We currently have 13 country research hubs in Africa, Asia, Latin America, and the Caribbean, and Europe. SIHI Talks is a series of monthly webinars that we hold to provide a platform for potential and current partners to connect and find opportunities to collaborate. Welcome! We're glad that you could join another conversation on social innovation today.
All right, so I hope you got to know a little bit about SIHI and SIHI Talks through those videos. So thank you all for joining us at today's session. My name is Julia. I'm from the SIHI Secretariat, and welcome to SIHI Talks. So this session is organized in collaboration with the Hope Network. And like us at SIHI, they are a global initiative that is interested in developing health interventions and social innovations through community-engaged methods like crowdsourcing and designathons, but with a specific focus on HIV. And so today we'll be talking about implementing designathons to develop solutions in multiple countries to end HIV transmission in East Asia. So drawing from the experiences of their in-country researchers. So this topic aligns with SDG 17, Partnerships for the Goals. So the program is pretty straightforward. We'll be having 4 short presentations. So we'll get to have an exchange and a variety of perspectives. And after the presentations, we'll have an open question and answer session. So you are free to use the chat box at any time during the program for comments and questions. So just type them in and we'll entertain them either through the chat or at the Q&A portion of the program. So, all right. To give more background on the Hope Network and what we'll be learning in today's session, may I call on Associate Professor Jason Ong, an academic sexual health physician based in Melbourne, Australia. He has applied crowdsourcing methods and designathons for HIV prevention in Australia, China, and Nigeria. So, Dr. Jason, are you there?
Yep. Thanks, Julia. And thanks to SIHI for hosting us. So I'm the leader of the Hope Network, and just a couple of minutes as to introduce our network. So the reason why we exist, so we started about 2.5 years ago. So the main focus of our network is to decrease HIV new infections. So this on your screen is just the number of new infections. In 2023, 1.3 million, and we're completely off targets from what the UNAIDS is asking us to achieve. We are underutilizing an amazing technology, which is PrEP, which we know is up to 99% effective. But you see here in the Asia Pacific region, we are supposed to be at about 8 million plus, and we are probably closer to 250,000 people. So there's a lot of work to be done to get to these goals. So our network was birthed, as I said, 2.5 years ago. So head of countries are here. So Nitaya in Thailand, Nina in Philippines, and Nita or Rita is our project manager. The main aim of our network is to ultimately reduce HIV transmission in East Asia. And our focus is on using PrEP or scaling up PrEP. So the 3 areas of countries of focus, Australia, Thailand, and Philippines. But we also welcome other countries to join us. So we are a network of regional experts. We are a mix of research, community leaders, policymakers, and we co-design. So a lot of the, we'll be sharing about one of the methods that we use, but we're very, we put communities in the center of what we do. So these are some of the methods we use. So crowdsourcing, as you all are quite aware of, we'll talk about designathons. We also have had discrete choice experiment workshops. And then this year, we also had an AI workshop. So these are some of the methods that if you join us, we can also upskill you in this. that's it from me. Thanks very much.
Thanks, Jason. So we have exciting presentations from different countries. And to start, we'll start with Australia with Warita Kyosaparan, a PhD candidate at Monash University. She has conducted a crowdsourcing to seek ideas on increasing the awareness and uptake of PrEP among Asian-born MSM in Australia.
Can you see my screen?
Yes.
Okay, perfect. Thanks, Julia, and hi everyone. I'm so delighted to be here to talk about our designathon in Australia. Before I talk about the designathon that we conducted in Australia, I want to share with you that WHO TDR has just launched a designathon practical guide, which includes the practical tip on how to conduct designathons. This guide was developed based on a systematic review and crowdsourcing open call. You can scan the QR codes to access them, or you can email me to get the links. My email will be on the last slide. I will stay on this slide for like 10 seconds. If you want to scan the QR code and check out the systematic review, the crowdsourcing open call, or the practical guide. Okay. Now, before we start, for those of you who don't really know what designathon is a term-based 4-stage participatory activity informed by design thinking. It involves multidisciplinary participants and end users to create solutions to a specific problem. The 4 key stages of a designathon include define the purpose of designathon and scope of this problem, preparation with end user, an intensive period of collaborative teamwork, typically from a few hours to a few days, follow-up activities for implementation and research, including the evaluation of solutions by topic experts or community partners. Our designathons were conducted based on these steps. Now, let me give an example of a designathon we conducted to reduce HIV transmission in Australia. Our designathon title is Let's Get Prepared Designathon. This designathon aims to develop interventions to increase the awareness and uptake of PrEP among Asian-born men who have sex with men in Australia, which is one of the key populations if we want to end HIV transmission in Australia. Our 3-day designathon was conducted in Melbourne in April last year. Here's the summary of our designathon. Our designathon is a hybrid designathon with participants attending the event in person and some mentors calling in online. We had both health and non-health related participants. The final products were prototypes, which were implemented in a randomized controlled trial within 12 months after the designathon finished, which I will also talk about it later. This slide shows how we organized our designathon. Firstly, we created steering and organizing committees. Secondly, the committees created the rules, invited mentors, and prepared the material for the designathon. Thirdly, we recruited participants through local organizations and booked the venue. Fourthly, we selected the participants and finalized the detail of the event. 1 week before the event, we had a pre-event Zoom meeting and provided the participant with the handbook. In total, there were 8 teams with 30 participants. There were 9 mentors and 3 judges. Our designathon process started from team building capacity, group discussion and mentoring sessions, solution submission, pitching, judging, and winner announcement. Here are the photos of the pitching, judging, and winner announcement stages. The solutions curated during this event were emerged into 2 themes, including online services and promotional media. The winning solution is Hot Peach Tea audio drama, which is a mini-series about the journey of the newly arrived Chinese gay man who is guided by two Asian queer sisters about sex and how to protect himself from HIV in Australia. Here's a little cut of the audio drama. I'm gonna play it.
Yes, yes, I know what you are thinking. Asians playing badminton. Of course, I don't have to be Australian or have my PR to know the stereotype. But it has been an amazing way to meet new people, and we are quite good. Someone even calls us something like.
So that's just a little 10 minutes cut from the actual 3.5 minutes audio drama that the winner team presented during the designathon. And here's the prototype of the audio drama advertisement created by the winning team during the designathon. So they plan to use this type of poster to promote their audio drama. Here are other prototypes from the other teams. You can see that in a short period of time, they created amazing prototypes, including a TikTok video application and game. Here's the final stage of our designathon. We evaluated our designathon using post-workshop survey and implemented the winning solution in a clinical trial. The post-workshop survey showed that most people were satisfied with the event. And here's a little snapshot of the result of our trial. So we just finished our recruitment and we are in the process of analyzing the data. I just want to highlight that trial participants were much more engaged with the audio drama compared to the reading and online website about PrEP, which is the control arm in our trial. And that's the end of my presentation. If you have any questions or if you want the links to the practical guide or the systematic review, feel free to email me. Thank you.
Thanks, Nita. And I agree, an audio drama is a very creative way of addressing these health challenges. And it's one of the benefits of a designathon and having different ideas come together. And I'm glad that it showed a lot of engagement. All right, so for the second presentation, we move on to the Philippines, and we'll be having Arturo Onqueco Jr., who is also the co-lead of SIHI Philippines and the SIHI Global Secretariat. So he is a University Research Associate at the University of the Philippines. And in 2022, he served as the project manager for Hope Philippines and has implemented a crowdsourcing call and a designathon to increase awareness and uptake of PrEP among MSM and transgender in the Philippines. So, Sir Art, take it away.
Let me just quickly share my screen. Okay. Can you see my screen now?
Yes.
Okay, so good day, everyone. I'm happy to present to you and share with you some of the experiences we had when we implemented the Hope Philippines project. This is supported by the Philippine Council for Health Research and Development and by the Foundation for the Advancement of Clinical Epidemiology Incorporated. And we closely work with our community-based sites in the Philippines, mainly working on the ground, heavily providing HIV and AIDS services such as Love Yourself, the Raha Community Center of the Family Planning Organization of the Philippines in Central Philippines, particularly in Iloilo Province, and the SAIL Clinic in Southern Province of Manila. So this is a one-year project, started from April 2022 and ended in May 2023. And then, as you can see, it's basically we would like to consider this sort of a journey from improving the PrEP uptake, starting with a bunch of desk reviews, KIs, and FGDs, and what we call those traditional way of data collection. And then we build on these experiences and the results of these two traditional data collection mechanisms into by launching some of the, in a way, emerging ways of collecting data and innovative ideas through crowdsourcing call and we then initiated the hackathon or designathon afterwards. So for the interest of time, we are focusing on these three experiences that we had during that time. So I'm just one part of the entire team. So this is the rest of the team. I'm headed by a project leader, Dr. Nina Castillo Carandang, and our co-project leader is Dr. Marisa Alejandria. Just like in Australia, we also organized our steering committee, who is actually in charge of reviewing innovations received, providing guidance on how to proceed with the designathon. It's the process of coordinating with innovators and other activities involved in the designathon process. And of course, the project team also served as the organizing team for these activities. So this is just a glimpse of the problem when it comes to the PrEP awareness in the Philippines, which is actually low in suburban and rural areas, particularly among individuals with lower incomes and limited educational opportunities. And the national access to PrEP is very limited. Out of the several regions in the Philippines, it's only available in just 7 of the regions. So taking a closer look at the hackathon or designathon journey, we call this as pagpupunla. So it roughly translates in English as the act of planting seeds, because we are only allowed to implement the project for a year. And traditionally hackathons or designathons would need more time, like a 24 to 48-hour sprint. But for in our case, since we have a limited timeline, we compress it in 1 day. And this, to manage expectation, we just call it like a session where we just try to unpack some of the innovations that we've received, and then evaluate whether or not these will be applicable in our settings. So again, zooming out from the entire project objectives, the review of the literatures, the findings on those activities, including the key informant interviews and focus group discussions, all become part of the inspiration phase. And we call that mga binhi in Filipino, or the seeds that will serve as the baseline of the ideation phase of the designathon. And of course, including also in that are the crowdsourcing winners. So we have identified top 10 winners, and then we've selected 3 winners that we've awarded with cash incentives and recognitions. They were featured in a designathon event, and as you can see, we allowed our participants from the 3 project sites to roam around, and from there, findings from the RL, findings from the FGD, and from the top crowdsource ideas, they can sort of mix and match these innovations and come up with a new one, or entirely copy or implement one in toto. So let's just briefly walk through the 3 innovations of the 3 implementing sites. In Family Planning Organization of the Philippines, they have what they call Rampa Preparado. It's basically capacitating pageant winners as ambassadors for PrEP. So basically, they will be trained on how to conduct counseling, community-based screening, and they will be fielded in their adopted communities to do these activities, and then enroll patients or potential clients to PrEP, from orientation to enrollment. Sale Kalamba come up with an idea of transgender pageant for PrEP. So it's kind of similar to the Rampa Preparado, but this time it focuses on the transgender population, because what Sale Kalamba come up with in their research is that there's virtually zero clients availing PrEP services or HIV and AIDS services in their clinic. So that's what we really want to tap into this untapped key population. And they basically field local transgender ambassadors. Well, they also train them on how to advocate for PrEP, and they basically wear that gown. As you can see, there are boxes there. These are the QR codes designed by the guy on the right side on a gray jacket. This is actually our first top one winner, first placer in our crowdsourcing contest. So he designed a gown embedded with QR codes that links to key HIV and AIDS and PrEP services of the Sale Calamba Clinic. So I would like also to show you that it's actually in action. It has been worn several times, and our local ambassadors won that one pageant. And then there are several other local pageants conducted over several months after the project. Love Yourself, they implemented what they call preppy spaces. They train individual volunteers also to reach out to potential clients through dating apps, not necessarily just Grindr or Tinder and other dating apps. And they teach them how to use free testing kits, set up telemedicine services, and basically serve as touch points for these gay complex in Manila City, in area in Manila, where most of the time they actually seek conversations with someone between 1 a.m. to 4 p.m. Under the guidance, of course, of a licensed physician. And then after having that conversation, building trust, they then link them to PrEP services of the Love Yourself Clinic. We only implemented for 1 month, again, because of the tight timeline. But as you can see, the number of potential eligible clients that actually enrolled in PrEP is just 31, but take note, it's just for a month. And for example, in Sale Calamba, from virtually zero, they enrolled 6 transgender women. So it's promising in a way. It's not a lot, but definitely promising. It's something that we can probably scale and test out further using a variety of methods. So, like I said, post-implementation evaluation surfaced the potentials of these innovations. But as you can see, most of these innovations are working under or operating under volunteers. So workforce consideration is a must. And replicability and further development of these innovations can be tested out further through an implementation research lens. And simplification of PrEP service delivery, the medicalization of HIV and AIDS testing will definitely require a wide-scale stakeholder engagement. So thank you very much. That's all for the Philippine team.
Thank you, Art. And again, it's really a highlight of creativity, not just in the innovations, but also in the way that we can frame the design-a-thon process, like how they did with the process of planting and nurturing seeds. And it was nice to see that each group had different innovations because they catered to different context-specific needs. So that's an important point. So now we move on to the third presentation. We have Artit Wongsak, is a program officer at Institute of HIV Research and Innovation. He has conducted a PrEP Power Designathon, a competition aimed at fostering creative problem solving, communication, and information dissemination to increase effective PrEP use in Thailand. So I
Hi everyone, thank you Julia for your introductions. In Thailand, I so in Thailand, ISI has a partner with Mahidol International College to establish a project PrEP Power. This initiative is designed to foster innovations and collaborations in fight against HIV by encouraging participants to develop strategies that increase effective PrEP use. Which make this competition special is focused on involving the community, making sure that most affected by HIV have a key role in finding solutions. In our target, participants include individual and group passionate about advancing HIV prevention through innovations. To support this, our secondary goal to make information available to everyone. We hold an online masterclass series. This series helps participants and the public understand about PrEP is and how it works. We also provide crucial information about their right to access free PrEP and where to obtain it. The effective PrEP use meaning giving people with knowledge and freedom to make informed choice about their PrEP regimens. For those already using PrEP, it's involved knowing when to pause and when to start and choosing a regimen that fits their lifestyles. For those not using PrEP, it is important to clarify that the process is straightforward and not complicated. The goal is to help everyone feel free to confident in making their own informed decision about whether PrEP is right for them. Our journeys began with an open call for applications, inviting team and individual to participate in our projects. We then host a PrEP masterclass to provide participants with essential knowledge about PrEP and prepare them to for upcoming challenge. Following this, we conduct a stakeholder interview to provide the opportunity for participants get more information from PrEP users and providers. Our designathon brought participants together for design thinking section using Lego series play, encouraging innovative problem solving and collaborations. The prototype visualization turning creative concept into tangible solutions. We engage in crowdsourcing to collect diverse ideas and input them to public for improving prototypes of each team. Each team then move into final pitching phase where they present their refined projects, and we conduct with the winner announcement, collaborating the most innovative and impactful solutions developed throughout the competitions. Our outlet strategy for Project PrEP Power was multiple phase, targeting 3 key groups: university, community, organization, and the designer communities. Our outreach strategy effectively engaged interest across multiple sections, resulting in total 37 applications, 31 teams, and 6 individuals. After evaluation process, we select 10 teams to move forward into the competitions. Those teams were chosen based on their intention, understanding overall context, and potentials. We have prepared the masterclass series, which include basic HIV and PrEP service and the current situation in Thailand, to make sure that participants clearly understand about PrEP, and participants can gain a better understanding to Q&A sections in the live class and also access recorded sections at any time. We also organize knowledge sharing activity that provide key insight into PrEP and the current challenge in the fields. Through the interactions, Q&A sections, the PrEP service healthcare provider and PrEP client of various gender identity, participants will gain more information about PrEP user experience. These foundations help them design more effective strategies, bridging the gap between knowledge and action to make PrEP more accessible and effective for everyone. We host a designathon workshop using Lego Serious Play, a tool that supports the design thinking methodologies. The workshop aims to using the internal knowledge within the team, drawing out diverse range of ideas and opinions. Following the design thinking sections, each team visualize their prototypes and present it back to the workshop. The steering committee provide feedback on their presentations. Each team developed their presentation and post them on ISI Facebook page and YouTube for public to provide comment and feedback. The team were required to consider this feedback to refine their work. During the final presentations, during the final pitching sections, Each team present their complete work to steering committee. The presentation showcased the team innovation and solutions, demonstrating how they address the core challenge and criteria outlined areas. Following each presentation, the judges provide feedback and evaluated the projects. Our steering committee comprises a diverse group of experts, including academic and research, specialized in business, behavioral science, and interdisciplinary studies. The project implementer with hands-on experience in execute projects, healthcare provider who bring a practical insight into healthcare deliveries, private sector representative contribute business and industry perspective, influencer who provide the broadening outreach and impact perspective. The projects will be was evaluated based on the following criteria: flexibilities, innovations, inclusivity, impact, and relevance. We conclude the event with winner announcement, celebrating the most innovative and impactful solutions developed throughout the competitions. Vitality Vanguard awards first place for their kiosk Prep Hero. This kiosk can provide SEV self-test, auto-interpreted result, and AI chatbot, and prep service. Content secure second place with their partner applications, which features stimulations, video game, chat function, medical history, and notification for PEP refills. SWT doctors earned third place for their vending machine PEP Care, offering a convenience combination of PrEP, SIV test, and condom within a single vending machines. After the PrEP Power projects, the innovation solution will be integrated in Decreed Choice Agreements or DCE, a research method that helps us understand how individuals make decisions on when faced with different alternatives. Through this agreement, we will uncover the difference that people are willing to make, provide valuable insights. The anticipated outcome from the DCE will be crucial in informing this design the service package for real-world implementations. This means that the solution developed to Project PEP Power will not only be innovative, but also practical and aligned with the needs of those they are intended to serve. That's all of my presentation. Thank you.
Thank you, Artie. It was a beautifully designed presentation, and it was very nice also to see a different kind of innovations that were brought out from a similar designathon process. So now we have more technology and machine-based innovations. And also it was good to hear that various voices from different fields were included in the process. So for our last presentation, we have Zohong Yin, who is a research assistant at the University of North Carolina Chapel Hill project in China. He participated in and conducted crowdsourcing and co-creation groups for mHealth intervention on PrEP adherence promotion in China. Take it away.
Thank you so much. Oops. Let me see. Okay. Hello everyone, and it's very honored to be here to share our research in China, and we use the co-creation group to develop digital messages for improving HIV PrEP adherence. And for the PrEP in China, it was approved since 2020. And in the period when we are trying to expand the protective effectiveness of PrEP in China, we encounter a lot of barriers. And one of them is we find that for the MSM PrEP users, the willingness and the behaviors of PrEP adherence remains very low. But for the existing literature or the evidence, we only find research using the quantitative way to find associations between the factors and the behaviors, but lack of the local experiences or the personal experiences for us to referencing to promote this issue. So considering the mHealth intervention may be effectiveness for us to achieving this gap, and we use the co-creation group to support the mHealth intervention. So the co-creation group is an iterative and bidirectional collaboration between researchers and the lay people to create knowledge. And these approaches also include the public online calls for input, crowdsourcing, and also the activities we use for the co-creation groups. So for the traditional co-creation groups, it contains 3 steps, and based on those concepts, we also use 3 steps co-creation groups, which contain the preparation, and we had a consultation with the focus group discussions, and also the evidence review with the PrEP users and the relevant stakeholders. And the step 2 is the co-production. In this phase, the group members will team up and trying to generate and revise their work to fulfill our requirement. And for the 3rd step is the post-evaluation, which include the quality evaluation of the products and also include the process evaluation of the participation. And the monetary incentive were sent after the attendance. So here is how we recruit our participants. We launched a clinic phase 4 trial in China using the FTC and TDF. And in this demonstration trial, we recruit our co-creation group participants through the 2 phase, which include the QR code to do the screening. And for those who report willingness, and we follow up with them and periodically and invite them to engage in our co-creation activities. So from the 2021 to 2023, we totally launched 3 rounds of co-creation group discussions, engaged with 19 PrEP users in China. And here is our findings or the results. And for the first part is how we engage with them and solicit the kinds of barriers for them to maintaining PrEP adherence. And based on the discussions from the PrEP users, we found that for the PrEP users in China, the barriers relies on main 4 levels, which include the structural and behavioral, motivational, and also informational. And for example, participants will report that they have difficulties for them to continuously using PrEP because they may have encountered some temporarily unavailable when they're in business travel. Also, they are report the lack of the knowledge of the PrEP adherence, and they don't want to prioritize using the PrEP medicine comparing to other treatment. So based on those solicited barriers, participants choose what they really want to thrive for and start to generate and revise those products in based on 3 dimensions, which are the content, the visual display, and also they discuss about their working procedures. So this co-production phase is bidirectional, critical, and commending. And there's a case list on the at the right side. They are talking about using the right symbol of the rainbow for represent the sexual minorities. So here is some of the products were generated from our co-creation groups, and we also do the quality evaluation to all of those products. So a total of 25 messages we co-created, and most of them are posters and pictures. And for the main themes of our products, we could see participants highlight the PrEP protection effectiveness on their PrEP adherence behaviors or performances. And also they concerned a lot about the PrEP side effects. And for we also assessed whether these kinds of co-created messages were useful. So we send the co-created intervention materials in our demonstration trial at the 6-month follow-up. And we could see that about 90% participants reported it's helpful. These messages were helpful for them to maintain their PrEP adherence. So regarding to what we had when we have finished our co-creation groups, we could see that for the MSM PrEP users in China, two main parties are emphasized for them to maintain their behaviors. And the first is the PrEP knowledge. The knowledge here is not refers to the general knowledge of PrEP, what is PrEP, or the effectiveness, the general one, but they do have a lot of concerns when they are actually using the medicine, and such as some using rules or flexible patterns for during their usage. And also the second part is for how we could promote their adherence performances. And besides the knowledge, education, and specific behavioral skills for dealing with expected daily interruptions were needed for them, such as how to deal with the alcohol consumption or short travels or uncertainty in medicine intake. So here we propose that the multiple modal and behavior intervention approaches were needed for the PrEP users to optimize their behaviors. And the key takeaway message too is about the co-creation is a useful tool for developing people-centered mHealth messages in Chinese context. First, we could see that this co-creation engaged the PrEP users in the whole cascade. They identify the problem and conceptualize and finalize all the products. And also, the considering PrEP care is a way for them to benefit the community. Participants report strong motivations to engaging the co-creation group. And also after the participation, they report their knowledge were enhanced through the way when they are engaging with the clinic and the providers and also the researchers. So at the last, we could find that in the recent years for us, when we are trying to do some creative work, the technology support the crowdsourcing or the co-creation in a huge degree, because it's really simplify the way for them to generate their ideas or to fulfill their needs. So this is what we had for our experiences when we were launching a co-creation group with the Chinese MSM PrEP users. And thank you very much for the opportunity to share with you what we had for the PrEP experiences in China. And here is our team of UNC Project China. Thank you very much.
Thank you for that presentation. Yes, there was a really thorough analysis of the barriers among PrEP users in China. It's a very, you really highlighted the research aspect in the presentation, and there also the different ways to deliver the messages that we want to disseminate. All right, so those are our 4 presentations from Australia, the Philippines, Thailand, and China. So now we will begin with a question and answer session, or just an open discussion. So for our audience, the chat is open. You can send in any insights, comments, or questions that you might have to all our speakers or to a specific speaker, and I'll read them out loud. But to start, we already have one from Beatrice. Hi, Beatrice. Nice to see you here. So I think this is a question for all the presenters. So she says, hello, many thanks for the excellent and inspiring presentations. Could you please elaborate on plans to sustain those interventions and if the necessary stakeholders were involved in the designathon? All right, so may I request all our presenters to turn on their cameras? It's a very good point because you did all mention the participants or the groups. So it would be nice to know who specifically are those participants. Who wants to start?
I can start.
Go ahead, Nita.
Standards intervention. I can talk about our designathon in Australia. So three of the prototypes that emerged from our designathon were further developed after the event, and two were further developed by researcher and one by the local community. So for the winnings, so we only work on the winning solution, but there are two others that got further developed by other people. And so for about this sustainability, so our plan is to test the winning solution, test its effectiveness in a clinical trial. If it's proven to be effective, we will apply for another funding to launch it in a national scale. So we will, once it's approved to be effective, we can get more funding, and that's when we can kind of upscale our solution and implement it in a national scale, and somehow we will get the community to tell us again about how to sustain it. So this one is more like people-centered, so we will try to get the community input to sustain the solution. And to answer the question about the stakeholders, we have researchers, community leaders, doctors in our designathon. And the feedback from our designathon was they appreciate the opportunity to collaborate with other professions and end users to address the problem that has been here for a long time. And this is not, this is a rare opportunity for all of them to work together. But the next step is to try to get policymakers to join our designathons. And that would be a great opportunity for the policymaker to actually hear the thought of the end users, the healthcare workers, and all the communities leaders. Yes, so that's the answer from the Australian team.
Okay, I can go next in order of presentation, maybe. All right. By design, if you can see, the Philippine team did not really started from scratch, meaning from the crowdsource ideas, we pull the innovators and develop completely from scratch. So definitely, our approach therefore is combine or mix them with the actual implementers on the ground, which are the three community-based non-government organizations, and showcase each and every bit of finding we had, both traditional ways of conducting data collection in insights from the people themselves, the patients, the clients, the health workers, crowdsource ideas from the general public, and then from the ideas of experts from the as members of the steering committee, and then put them together in one place, try to get best of each of these data points and come up with a new idea. So that's how we design our designathon activity, so that policymakers will have an insight on what's happening, what ideas can be generated by the general public, what are these bits and pieces that can be applicable, and as vetted by the non-government organizations who are going to implement it, and backed up by evidence, systematically organized in a literature review and by the FGD. So I suppose that became sort of the vision and mission of the Hope Network Philippines, to be that research arm using several approaches to evidence generation that can provide support to continuing support to these implementing agencies to provide innovative approaches in implementing and making PrEP and other HIV and AIDS services available to broader key population groups. So I suppose right now we don't have an active funding, but we continually collaborate with these NGOs to expand this work. Over.
Okay. For me in Thailand, I think we already have the involvement of policy maker and healthcare worker and stakeholder that involved in policy change in our projects, especially in the path of coming steering committee. Uh, as we saw that everyone in the steering committee can provide informations and how it works and anything in the innovations. Which part of this in the innovations it can be applicable in Thailand or it can happen in Thailand. As and another thing that I mentioned in earlier that we will plan to translate this innovation into the DCE survey that want to collect the decisions from the public or in the mass population, what how they thinking about this innovation, and some parts of this innovation is based for their choice. I think this one can compile to be a new innovation that can inform the policy maker to make their change or make their decision to provide the another in innovative service in our countries. Thank you.
Thank you so much for the questions. Since the practice in China is a little bit different from the designathon in the above mentioned countries, I just share about some ideas are relevant to your questions. I think for our practice is the elaborate on plans to sustain those interventions were available for us because those co-created products were the copyright of those products belongs to the research team, also belongs to the producer, and also because we had a demonstration trial to examine the effectiveness of those intervention. So after the trial, those co-created pictures or posters or videos were available to share from our CBO collaborators to promote the PrEP awareness or PrEP adherence for their community partners. And for the second question is if the necessary stakeholders were involved. For us, through the co-creation group basis, we engaged both the researchers, the PrEP users, and also the providers to help us get the scientific track of all those intervention materials. But we do reflect it on the necessary stakeholders because when we are trying to just merely focusing on the PrEP users, we find what we gain is limited because most of them they may face a lot of barriers when they're trying to maintain the PrEP adherence, but it seems they are like lacking of the skills or for their previous experiences, they don't know how to like take the medicine once daily. So for us, the future practice, I think we will engage more like their sexual partners or other people living with the other chronic disease. They may have a lot of skills or strategies for them to maintain the adherence. So that may be benefit for us to use those experiences on the PrEP users in China. So I think there's a long way to go for us. And thank you.
Thank you all. And yes, I think it was also highlighted by you all that the designathon is not just a place to develop the ideas and innovations, but it is a platform for stakeholder engagement and collaboration. So it's good to know that you all have plans for the innovations to be taken up by policymakers after generating evidence through research on the innovations. All right, so any more questions on the chat? We still have a time for maybe one last, or maybe I will just give the question. So as you know, like the SIHI network has a similar vision with the methods on crowdsourcing and designathons, but Hope is focused on HIV, correct? And maybe our participants may have heard of PrEP for the first time today. Raise your hand if it was your first time to hear about HIV PrEP. But my question is just, what do you think were the most important considerations in generating solutions for ending HIV or engaging with stakeholders for PrEP, for HIV PrEP, since maybe our audiences here have some experience in making social innovations, but for other infectious diseases. But when it came to HIV and PrEP, what for you are your most important lessons learned in these innovations?
Um, okay. So for me, what I learned from my work in HIV, I realized that HIV is the combination of issues with stigma, adherence to the prevention methods like condom, PrEP, and also people who don't really involve with sexual health. They don't really have an idea of how to protect themselves from HIV, or they don't really know that they are at risk of HIV. So it's also the issue about knowledge. And this is something that most people in general don't really have an idea of, okay, I am at risk of HIV, or I am not. And when they go to the doctors, it's the stigma that come with when you say it out loud, do I have HIV, is a very stigmatizing word for many people. And that makes addressing the problem that related to HIV is a very sensitive issue. And when we use designathon is when we actually work with the communities to find the right language, to write the right approach, and the thing that will not stigmatize them further. And somehow it will, this is what I talk with participants, that this opportunity that they get to talk to the doctor and they get to actually express their opinions, share their experience with other participants. Is actually, this designathon is more than just developing a solution to the problem, but it's also about them being able to share their experience and get their voice out to the policymakers and the research. Yes.
Great, thanks, Nita. Anything to add?
Okay. I suppose one of the healthcare issues and HIV and AIDS, in particular, for that matter, are complex issues, and developing complex sensitive solutions really require a lot of thinking process and mechanisms to flesh out details of those issues, like systematic issues, personal professional issues, healthcare work, supply and demand issues. So I suppose Designathon really provides that mechanism and platform as an approach to bring these people together, and really talk about how can we first identify the real problem so that we can address and pinpoint the root cause of the problem and not the symptoms of it. But another challenge for any human-centered and participatory design processes is time. And trust building requires a lot of time. And I hope there's a continuing platform within government or non-government agencies that we can just, sit in, have a conversation, and design systems and processes. And that, of course, people themselves, the client, HIV and AIDS the key population groups, will definitely be comfortable sharing their issues and concerns freely, without being judged. So it's really far from happening yet at this point, maybe, but I hope these bits and pieces of platforms, activities that we generated from the Hope Network can be scaled up more broadly in the national health systems. Over.
Will you be adding anything? Arkit and Zohan?
Okay. I had a little bit thoughts want to share, I think. For me to engage in the HIV prevention research or studies, I think the one thing I realize is when we are trying to engage in this topic, we should realize that it's not like a single disease for us to do, but it's correlated with a lot of like level issues or barriers such as the societal, the governmental, the cultural. It's related to a lot of hierarchies in our society. For example, when we are talking about the community-led model, it's just different in it's different in every country. I think it's not the same for the model or the collaborations in China and Australia. Every places have their own localized experiences and their own rules or policies for them to generate their own ways to coping with this issue. So I think for me, the most important lesson is we definitely should use the localized experiences to address the different issues or the barriers when we are trying to figure out the best solution. Yes, over. Thank you.
Yeah, for me, I agree for both of you. Or there are lots of combination is in SIV fields. For my experience when involved in SIV research, I found that there are difference, there are complicated in the populations. Each population they have their own challenge and barrier to get the HIV prevention and treatments. The designing the specific interventions or service for each population is need to investigate. In the designathon that we run in our cohort, we found that in the Gen population or in the younger population, they also have the challenge for get the service and have a challenge for their own parents for protect them to get the HIV service or HIV prevention, something like that. We also need to provide more intervention or service that specifically to these populations. Thank you.
Thanks, guys. They were really great insights, and we thank you for sharing your lessons on designathons and HIV research. So thank you all. So now I'm going to close the session. So thank you again, and thank you to our audience for registering and sharing your time and energy with us in this session. All right. So we have a post-webinar survey that we encourage you to answer, and in return, you can receive a certificate of attendance. And our next on our SIHI Talks lineup is Let's Talk Social Innovation in Health with our own researchers from SIHI Malawi and SIHI Rwanda. So that's an African context this time. So if you'd like to know more about SIHI, please visit our website or any of the social media pages as you see here on the top part of the screen. And if you would like to know more about the Hope Network, you can visit their website on the chat or contact any of our guest speakers today. So once again, thank you for joining us at SIHI Talks. We hope to see you at the next. Thanks, everyone.
Thanks, Julia, for being the great moderator.
Thank you, Julia.
Thanks, guys. You're welcome.